Hi, I'm Ashley Visco. I manage the outpatient case management team here at Hershey. My team is an interdisciplinary group of nurses and social workers who provide outpatient case management to our family medicine practices as well as many of our specialty clinics. Today I'm here to speak with you about your ambulatory care rotations. So what is ambulatory care? It is the care of patients who receive treatment on an outpatient basis, as in they don't require admission to a hospital for an overnight stay. Ambulatory care includes those clinical, organizational, and professional activities engaged in by registered nurses with and for individuals, groups, and populations who seek assistance with improving health and/or seek care for health-related problems. The American Academy of Ambulatory Care Nursing describes ambulatory care nursing as a comprehensive practice which is built on a broad knowledge base of nursing and health sciences and applies clinical expertise rooted in the nursing process. 99.9% of your patient's life is not spent in the hospital. Ambulatory care meets the needs of our patients outside of any hospital setting. It requires keen clinical assessment and critical thinking skills that are needed to provide care over the continuum for your patient, not just at one point of time. Our goal with these clinical opportunities is for you to get an in-person look at the ambulatory world. Over the last several years, the focus on ambulatory nursing has become more prominent. Oftentimes, people see this type of nursing as something that doesn't take as much skill or reasoning as other types of nursing. That could not be further from the truth. Nurses and their colleagues in ambulatory care use critical reasoning and problem solving daily to help patients overcome barriers and reach maximum health outcomes. There are so many opportunities for you to begin your career in the ambulatory world. This is truly an important sector of healthcare, and we are uniquely structured to meet increasingly complex needs of patients and communities. We wanted to structure a program that would let you experience a variety of opportunities as well as care team models focusing on primary care, specialty care, and procedural care. Since the ambulatory world is still growing, you will find some teams are more robust than others. If you happen to follow an RN from my team, you'll see the nurses primarily provide care to our family and community medicine practices. The majority of the work that we do is actually outside of clinic visits. In surgery, you're going to be working with patients who may come in with what you might consider a routine procedure, but to them is actually incredibly significant. At Lebanon Free Clinic, you'll work with patients who aren't able to access healthcare for one reason or another. And in transplant, you'll get to shadow a social worker and watch how the entire team works to evaluate a patient for a life-saving procedure. Also, during the first week of September, you will get the opportunity to participate in a simulation regarding social influences in the community. During this simulation, you will take on the identity of an individual who is struggling financially. Your simulated community will be in our University Fitness Center. Throughout the course of the simulation, you will need to find transportation, go to work, and feed your family. You may also struggle with chronic illness. Throughout the month, you will face daily stresses and challenges. You'll be partnered with students from a variety of disciplines: medical students, public health students, social work students, and even law students. We hope this, along with your clinical rotations, provide a meaningful experiential learning opportunity for each of you. If you ever have any questions, please do not hesitate to reach out, and I look forward to working with you this semester.